let's talk a little bit about the science around minimally invasive spine surgery. And what is it that patients need to know about the various techniques that exist? Again, minimally invasive spine surgery, as you've all pointed out, it's a philosophy as well as an approach. And at the Society for Minimally Invasive Spine Surgery, there's a lot of research, there's a lot of discussion, and a lot of science around new technologies that are available for addressing various problems that patients have when they come to see you. Let's talk a little bit about what those techniques are and what it is that patients need to know. Should they care about what approach their surgeon uses, or leave that up to their doctor to make that decision for them? Or is there a shared decision-making opportunity that ought to be as part of that discussion? And I'll ask you first, Dr. Qureshi, to comment on that.
Sure. So I think for most of what we do in spine surgery, shared decision-making is critical because in general, there are multiple approaches and multiple thought process in terms of determining the best treatment plan, surgical or non-surgical. With regards to the technological advances that are helping us, I think that there's a lot of opportunity there, but we happen to live in a time where we have benefited from a lot of advances that have helped surgeons as well as our patients. I think some of the ones that are very recent and top of mind are the advances in robotics and imaging technology in the operating room that help us to really deliver a product that perhaps in the past could only be done through open techniques, but provide it in a minimally invasive manner.
And do you talk about that approach with your patient when you're evaluating an approach? Is that something that when patients come to see you is a discussion that they have, and how do they know what to ask you about it?
How do they know? I think, I happen to be in a practice environment where patients, I think, do a lot of research. So I'm always really impressed with the questions that they're asking. And again, it's a conversation. In general, I start by talking about the symptoms, and I always ask, if I'm going to tell you that you should have surgery done, what is it that you would like to get better from that surgery? Because that will help me understand what a person's goals are and whether they're realistic and whether surgery is going to be the right thing for them.
Yeah, that's great. I'm going to send it down to Dr. Wang to comment on that.
Yeah, it's interesting. We're all from different cities, right? Yeah. Big cities in America, so the patient population is a little different. South Florida, very old patient population. My default mode is always to sort of offer what's least first. But I think if a patient were to think about the spine, one of the ways it differs from other types of surgeries is you could think along 3 dimensions, okay? 3 dimensions of care for a surgical procedure. The first is geography, like how much of the spine, how many levels? People want to know, is it 1 levels, 2 levels, 3 levels, 7 levels? And that's the numbers, right? The numbering of the vertebrae. The second part is about what you're really going to do there. What's the intent? Are you going to do a fusion? Are you going to do a realignment? Are you just decompressing a nerve? And that is sort of like purpose build, like what are we really trying to accomplish at those geographical areas? And the third is really where we're alluding to is the technical approach. In other words, you're coming through the front of the body, the side of the body, the back of the body, how big an incision, as Dr. Anand said, muscle splitting versus muscle cutting. And then those are the more tactical pieces. But if you put those 3 dimensions together, you end up with a large number of permutations of types of surgeries, which is why spine can be so mystifying, because there's so many different ways to do surgery or fix a problem. They all have pros and cons.
Yeah, so sort of 2 comments. Agreeing with others about the patient being very involved in the surgical decision making. And part of that gets down to, many other conditions in medicine are absolute. There's a solution and this is how it's done. In spine, every decision, every procedure is a compromise, right? Like you say to a patient, for example, their main problem is a pinched nerve. They also have instability, which could in 5 or 10 years become symptomatic. So then there's a discussion. Do you just want to take care of the problem that you have today with a high likelihood of success with a minimally invasive surgery? Or should you do a larger surgery, which maybe is, quote, overkill today, but it sort of takes away that risk of progressive symptoms over years? And that's very individualized. Like some patients, maybe it's their age, maybe it's their mindset. They just want to play golf next week. say just do the small procedure, we'll deal with it later. So it's very important because there's always some compromise. We're never really fixing the spine, we're managing the spine is how I look at it. And then the other part of your question, which I think is very important, is the science you asked about. Because many of the minimally invasive techniques we all use are very well validated with years of science and studies and confirming their effectiveness, their safety, the patient benefit. What patients have to really be careful about is there's a lot of marketing out there. There are a lot of minimally invasive procedures touted as the next greatest thing that have very little science behind them. And I think, it's a difficult field for patients to navigate. They feel kind of lost because the guy they're seeing says, oh, this is the greatest thing ever. But we're all saying there's no data around it. So I think it's really important for the patient to kind of get involved. Ask your doctor about that. Is there science? Is this what your procedure you're proposing? Actually a reasonable, validated, safe procedure. I think it's really important that the clinical decision-making has to be driven by the studies and the science that we have.